Sydney Research brings together world-leading researchers, academics and clinicians. We are passionate about improving the lives of people in our community and around the world. With over 2,000 researchers from Sydney Local Health District, the University of Sydney, 11 medical research institutes and centres, and the Primary Health Network, our success is remarkable. Last year we published over 3,200 publications and received over $81 million in competitive Category 1 grants. Nearly 30% of these were ranked in the top 10% most cited worldwide. We are very proud of our many achievements. In the last 12 months, some of these include testing of a promising new medication for lung cancer, development of a revolutionary stent coating, and a technological tool to help people make healthier food choices. We've opened new cutting-edge health and medical research centres, including the nation's first Institute of Academic Surgery with the state-of-the-art Da Vinci surgery robots.
Da Vinci is ready.
With our partners Northern Sydney Local Health District, Western Sydney Local Health District, the Sydney Children's Hospital Network, the University of Sydney and our medical research institutes, we have formed Sydney Health Partners. And we've achieved new recognition by the National Health and Medical Research Council as an advanced health research and translation centre, only one of 4 in Australia. The Sydney Research Awards program not only recognises talent in research, but also the work of those who support, guide and mentor our researchers.
The wish list is to see that the younger academics that we have taken into the Institute on this model. I want to see them develop and actually have a career that races past us and makes us look good by how well they go.
It's about our patients getting the very best care possible through our culture of research, teaching and the best clinical practice.
We do clinical trials in heart, lung, kidney, liver, cancer, surgery, anaesthesia, paediatrics. The whole spectrum of abnormal human health is covered in SLHD.
Last year's award winners were impressive. The wonderful Professor John Chalmers from the George Institute, Associate Professor Sydney Chang from RPA, and Dr Kirsty Waters of the Anzac Research Institute. Our future research is made possible through scholarships, grants and infrastructure funds. And we are so grateful to our many supporters for all of their contributions.
So my grant was the infrastructure award, and so that went towards the purchase of 2 incubators for the C. elegans, or the worms that we're actually growing for to model one of the diseases that we're working on. The disease that we work on is an inherited peripheral neuropathy called Charcot-Marie Tooth disease. We're hoping to start applying or using this model in some of our families where we don't know what their gene mutation is, but we're very close to finding them. I mean, this grant, even though it's in some eyes might be seen as a small little grant, everything counts. And without those incubators, we can't grow the worms up. And so, it's sort of in some ways the foundation of this project.
So I'm looking at how we assess lymphedema and looking at developing a health informatics tool to help us to do that better. To free up clinicians to do research is really, really helpful, really important. Also building bridges so that clinicians aren't frightened of research. So the scholarship and the way that it's designed is fantastic for supporting that. It's really freed me up to be able to pursue something that I'm very passionate about and something that I think can make a difference to people with lymphedema. Hopefully I'll have a database tool that will be so great that it won't be just me using it, but therapists worldwide.
It's actually enabled me to enrol in a doctorate to undertake and develop research skills that is addressing a significant problem within the health district, hospital-acquired pressure injuries. It's been a very supportive, collaborative experience, and I've learnt so much throughout the whole process and within just such a short period of time. So the research that's been undertaken we already have findings. I'm extremely confident that towards the end of this research, if the approaches have been adopted by the district, that we will have a sustainable reduction in hospital-acquired pressure injuries.
Becoming world leaders is one thing, staying there is another. As leaders, we need to ensure that we attract the best, keep the best, and invest in our future researchers so that we can provide our patients and our community with the very best care possible. Welcome to the Sydney Research Awards 2016.